SIBO stands for small intestinal bacterial overgrowth. Bacterial overgrowth in the small intestine can lead to excess formation of gas, leading to symptoms of IBS, and SIBO is diagnosed via the lactulose breath test, which measures certain types of gas made by bacteria. The lactulose breath test first starts off with the patient consuming a sweet lactulose solution, and afterwards breath samples are collected to measure peaks in gas. Once there are peaks in hydrogen or methane, SIBO can be diagnosed. Part 2 of my SIBO series. SIBO stands for small intestinal bacterial overgrowth, and it's considered one of the root causes of IBS or irritable bowel syndrome. SIBO recurrence after treatment could happen if risk factors of SIBO aren't addressed. There are so many risk factors for SIBO, but one of the more common ones that I see in office are going to be 1. Past history of recurrent antibiotic use, 2. Past history of heartburn medication like Prilosec, 3. Past history of abdominal surgery, and 4. Past history of food poisoning and/or traveler's diarrhea. Understanding these risk factors will help providers understand even more how to best treat their patients with SIBO and prevent recurrence. Part 3 of my SIBO series. SIBO stands for small intestinal bacterial overgrowth, and it's considered one of the root causes of IBS or irritable bowel syndrome. After SIBO is diagnosed via the lactulose breath test, a provider may recommend pharmaceutical or natural treatment. And the whole entire goal with either pharmaceutical or natural is going to be bringing the gut microbiome population into balance so there is no bacterial overgrowth in the small intestine. In regards to pharmaceutical therapy for SIBO, doctors tend to prescribe antibiotics, and those antibiotics can be neomycin or Xifaxan, but there are so much more. And in regards to herbal treatment, evidence shows that certain herbal preparations are as effective as rifaximin or Xifaxan. However, do note that herbal treatment was done for 4 weeks, while pharmaceutical treatment was done for 2 weeks. There are pros and cons for both pharmaceutical and natural, so make sure you work with a provider who's versed in both pharmaceutical and natural to clear up any confusion or even misinformation that you've been hearing. Make sure to follow along for part 4.